Well, I want to conclude this lecture on psychotherapy techniques by talking about biomedical treatments, okay, including especially drug therapy, which of course is incredibly common. Started in the 1950s, where you start having these pills on the market. So, drug therapy, control of psychological disorders through the use of drugs. Okay, antipsychotic drugs, for example, these temporarily reduce psychotic symptoms such as agitation, hallucinations, and delusions. People with schizophrenia typically need very much need antipsychotic medication, usually in addition to other aspects of therapy. Antidepressants, very common out there these days. Medications that improve a severely depressed patient's mood and feeling of well being. These can be abused by people who don't necessarily have severe depression. They're just trying to get a little bit of a mood boost. Basically, they are involving, they tend to be SSRIs, okay? Selective serotonin reuptake inhibitors, okay? So, in other words, they are trying to prevent the postsynaptic membrane of neurons from reabsorbing the serotonin that was just released from the synaptic buttons. Okay, so we covered this a little bit a while back in the course, but basically the idea here with SSRIs is to increase the overall amount of serotonin in the brain. Okay, some examples are Prozac, Zoloft, and Paxil. Mood stabilizers, these are a little bit different. Lithium's the very common example here. Medications used to treat mood disorders, okay, typically with bipolar disorder here. Anti-anxiety drugs, these help reduce levels of anxiety by reducing excitability and increasing feelings of well-being. Okay, Xanax and Ativan, for example. Well, ECT is another biomedical approach, obviously not a drug approach. ECT is a procedure in which a current of about 70 to 150 volts is briefly administered to a patient's head. It's usually not as extreme as they show in television and movies, okay? It's also very rarely used in this day and age. It causes a loss of consciousness typically and can cause some seizures as well. It's only used in extreme circumstances, but it has been shown to be successful for severe depression when all other measures fail. Okay. Okay, that's the end of lecture for this topic. Only one more topic left: social psychology. Quite a bit to cover there, but I look forward to getting into that topic with you. If you haven't already, start preparing for the final exam. And again, email me with any questions that might arise.